Welcome. My name is Peter Strong. I'm a professional psychotherapist and I specialize in mindfulness therapy, which is a form of Buddhist psychotherapy for the treatment of anxiety and depression. And I offer online therapy via Skype to make it more convenient, more available for you, and this is particularly useful if you find it difficult to find a therapist in your local area to work with, or if you're living abroad, or if you just want the greater convenience of being able to see a therapist online instead of having to travel to see a therapist in their office. So as long as you use Skype, which is what I use for all of my online therapy sessions, then the quality of communication is just as good as meeting in person. You really don't need to be in the same physical location as your therapist to receive good quality psychotherapy, but it is, in my opinion, essential that you can see each other. So that's made possible by the use of Skype or similar video platform like FaceTime or Zoom. As long as you can see each other, and then there's no difference. Especially if you're looking at a style of psychotherapy that's really designed to help you better manage your emotions yourself without the use of medications or other medical treatment. So I don't provide medications, and I don't even recommend them for treating anxiety or depression, because medications don't really give you the tools to work with your emotions. They're just a way of dampening symptoms, and they don't usually work well for long-term management of anxiety or depression. You will get much greater benefits by actually working on the underlying cause of your anxiety or depression. And that cause is psychological in nature. So anxiety and depression and other forms of emotional suffering are produced by internal habitual processes. And that's what we work on in mindfulness therapy, which is this particular system that I've developed over the years for the treatment of anxiety and depression. So the underlying habitual processes that create anxiety and depression are really made up of some well-defined parts that we need to address in our therapy sessions. The first is called reactive identification, and this is perhaps the most important problem that stops anxiety and depression healing naturally, that actually feeds the anxiety or depression. So reactive identification describes that process where you become blindly attached to those habitual reactions. You just become a slave to the reactive thinking and the emotional reactivity that feeds your emotional suffering. So overcoming this blind habitual identification with your emotions and thoughts and beliefs is a central part of mindfulness therapy. And we do this by learning how to meditate on our emotions. So meditation is a way of focusing conscious awareness on the mind. And this is what is most needed. So habits thrive because they are not seen. They operate at a subconscious level. They're unquestioned and unexamined, and they just run automatically in the background every time that we encounter a particular set of triggers. Then these conditioned reactions get triggered, and we simply suffer in the consequence of that. So overcoming this blind process of reactivity is central. And we do it by meditating on those emotions so that we can make them conscious and see them very clearly. So we can see the exact reaction that is triggering your anxiety or your depression or any other emotion. When you bring it into conscious awareness, you take away its power. You also completely change the identification that's going on. So when you blindly identify with an emotion, you literally become that emotion. And that's why we say things like, I am very angry, or I am afraid, or I am depressed. That's an example of reactive identification, where your whole identity has become consumed by that particular habitual reaction. So changing that means that we cultivate our true self, which is actually not the contents of your mind, but the observing presence, that conscious awareness itself that can see the contents of your mind. So that's why we often talk about the essential nature of your mind as being spacious, as being essentially the space that contains emotions and thoughts and beliefs and other content. You are not the content of your mind. You are that space around the content. But what happens with reactive identification is that we lose that perspective and we become the content of our mind. We become caught up in our emotional reactions and our thought reactions. So meditation is a way of cultivating and re-establishing your true identity as that observing presence, pure conscious awareness that sees the emotion, that sees the thoughts, that sees traumatic memories, but does not become them. So the way to cultivate this is to deliberately, consciously meditate on those emotions. That strengthens your identity as the observer, which is your true self. So we cultivate this relationship where we're sitting with the contents of our mind and training out of reactive identification. And that in itself creates huge changes that lead to healing and recovery from anxiety and depression. So that's very, very important. We can even increase the effectiveness further of developing this objective consciousness by bringing in the element of compassion or friendliness. This is one of the main parts of mindfulness. Mindfulness can be described as the combination of conscious awareness and compassion or friendliness or openness of mind. So we develop this compassion towards our emotions. They need that compassion more than anything else. And that is what is usually completely missing or fractured. We do not have a good internal relationship with our emotional pain. Typically, the relationship is based on aversion and trying to push it away, some form of avoidance. But it's definitely not based on compassion, openness, and friendliness. So that is but if it's not based on compassion, then that aversion, that self-hatred will simply feed the emotion. And avoidance will feed the emotion. So in order to promote its healing, we do have to develop this internal conscious and compassionate relationship, a mindful relationship with our emotions. The compassion increases the rate of healing, as it would do between people. When you bring compassion to bear on emotional suffering between people, it increases the rate of healing and restoring balance and well-being. Well, this same principle operates in our own mind as well. If there's no compassion internally, there'll be no healing. But when you cultivate compassion through meditation on your emotions, then you will accelerate the rate of healing. So this is a little taster of the approach we call mindfulness therapy, which is so effective and has proven to be so effective with anxiety and depression in particular. If you'd like to schedule online therapy with me via Skype, and you like the idea of being able to talk to a therapist online, to see an online therapist rather than going to see a therapist in person, then do please contact me and let's schedule a Skype therapy session. The approach that I'm going to be teaching you is very effective, and almost everyone that I've worked with sees tremendous improvements within the first 3 or 4 weeks when you start to apply the mindfulness techniques, including mindfulness meditation, that I will teach you during these sessions. So if you'd like to work with me as an online therapist teaching mindfulness therapy, then please contact me. Thank you.